Hi, my name is Sunil Patel. I'm a hematologist oncologist here at Kelsey-Seybold Clinic. Oncology specifically for me was a fit because I loved the scientific part of it, so trying to understand the disease and what makes cancer cells grow, and then what we can do to fight cancer is very science-based. But then how we actually talk with patients who are dealing with cancer and living with it is very human, that you're on their side and that you want to help them fight it too. As a medical oncologist, I will interface usually with my patient's primary care doctors first. Then I'll help establish the diagnosis, usually by doing a biopsy. If the diagnosis is cancer, I sort of become the quarterback and I help outline the treatment plan in conjunction with the other doctors who would be involved. In that way, we work together to make sure that we're handling that patient's cancer. For me, the biggest thing is being honest and then answering questions as accurately and as completely as I can, and then making sure that they're aware that even once our encounter ends, I'm still available to them after that. So that relationship doesn't end when the door closes, but rather that's just the beginning of what's going to be a really long relationship. So Kelsey's a place where the doctors work together. When you see a Dr. Kelsey-Seybold, you're not just seeing that one doctor, but you have access to all the other doctors within Kelsey-Seybold's group. And through that, you get a lot of expertise. I could work in concert with primary care doctors on the front line, as well as specialists of every different type to make sure the patient was getting what he or she needs from stem to stern. What I see every day is the strength within my patients and in their families. And it's a humbling thing to guide someone through a difficult time, that every day people can go through really hard things, but come out on the other side of it stronger. And to me, that's extremely inspiring, and that's why I do what I do.